Hi, I'm Susan. I'm 75 years old, and I have a chronic form of arthritis called calcium pyrophosphate deposition disease, which basically means I occasionally form a lot of crystals inside my joints, and it wears the cartilage down. So, with that in mind, I noticed I was having an increasing problem with both of my knees. I had already had bilateral hip replacements, had the x-rays on my knees, and I had no cartilage in either one, actually. And so at that point, my choice was going to be more joint replacement, and I would prefer to avoid that. So I started researching. I had one of my physician's assistants at my primary care physician suggested I contact Dr. Pearl because she had worked here for years and was very impressed and said, before you perhaps have a knee replacement, go and see her. So I did, and Dr. Pearl spent an awful lot of time with me at that point. It was all via Zoom, but she spent about an hour discussing all the different parameters, what it meant, the cost, my chances of having a successful procedure. So I thought, well, it's so much less money and so much less aggravation than having a knee replaced. I should say I'm a retired OR nurse, so I kind of know about these things. And went forward and we did that. And she had to aspirate bone marrow from my hip, which really was not painful at all. It was all done in a single procedure. Mix that with a little fat aspiration, which unfortunately she couldn't take much of. I asked her to take a lot, but she didn't. And then as well as protein-rich plasma. That was all in a few hours, re-injected into the joints. Then I came back a few times, I think every 4 weeks, for protein-rich plasma, as well as physical therapy. And all I can say is it's been 6 solid months now of no pain, no problem, full range of motion. Physical therapists have a hard time believing this is the same knee, or both knees actually, although the left one wasn't as bad. And it's been wonderful. Give it a try.